All right. We are here live in Taxes and Retirement with Danielle Roberts of Boomer Benefits. Hello, Danielle.
Hello.
How's it going?
Pretty good. We're hanging in there tonight. How about yourself? A little colder up there in New Jersey where you're at.
It is, yes. It's that time of year where we're starting to get there, unfortunately. But the summer was nice and the fall was okay so far, so I'll take it.
You're good.
Well, great. Thank you. So for those who don't know, again, I'm here with Danielle Roberts, the co-founder of Boomer Benefits in Dallas-Fort Worth area, which is Boomer Benefits is one of the nation's largest Medicare insurance agencies. Danielle is also the author of her first book, 10 Costly Medicare Mistakes You Can't Afford to Make. I just personally finished this book last week, and it is absolutely fantastic. So thank you for that, Danielle.
You bet.
I've read a handful of Medicare books, and this one is hands down the most informative, most straightforward, most easy to digest one that I've come across. So thank you for that.
Good to hear. Thanks.
As you know, Danielle, I'd like to start with a disclaimer. So just give me a second here for everyone watching at home. This video is only general explanations and education. It's not specific tax, legal, or investment advice. Before considering acting on anything you see or hear here, first consult with your tax, legal, or investment advisor. Thank you.
That is just awesome.
Yes. And Danielle, dad jokes, as you know.
Let's bring them on.
Warm up the crowd with some dad jokes. And in honor of having you on to discuss Medicare, I've handpicked 3 healthcare-related dad jokes.
Okay.
Let's see what we got.
Hit me with them.
So, Danielle, you missed my chiropractor joke the other day. It was about a week back.
God.
Yep.
Okay.
They get better. And by better, I mean worse. So hold on. Unfortunately, my dad died because we couldn't remember his blood type. In his final hours, he keep insisting, be positive. But we can't. It's really hard without him now. So we misinterpreted that message. Yeah, that one's a little grim. And finally, a man rushed into a doctor's office yelling, "Help, I'm shrinking." The doctor said, "Calm down. They just have to learn to be a little patient."
Good one.
Yeah,
that's terrific.
Thanks. All right. With that out of the way, it's good to see some live feedback here. Normally, it's just me talking to a camera, hoping people are chuckling at home. So Danielle, maybe start us off. Just tell us a little bit about Boomer Benefits and what you do.
Sure. So we are a licensed insurance agency that specializes in Medicare, and we help baby boomers navigate that entry into Medicare across 48 states. New Jersey is one of them. It's Texas as well. And we specialize in education. So one of the things that comes along with Medicare is a first time learning a national health insurance program. So we spend a lot of time just educating people about how that national health insurance program works, what it provides, what it costs, what it covers, and helping them get a good handle on that part first. And then on the back end, when they're ready, we come in with the supplemental products, which is the part that we provide. And probably our claim to fame is just a client service team. My brother and I invest over $1 million a year in payroll for a team that helps policyholders on the back end.
Okay.
Because one of the things people don't realize about Medicare is once you get everything set up, that's terrific, but things happen on the back end that you don't know how to fix. Like your doctor miscodes a bill, so Medicare denies the bill, and you don't know where to start. Do you call Social Security? Do you call your doctor's office? Do you call Medicare? Or you're standing in line at the pharmacy and your pharmacist tells you, well, your Part D plan won't fill this medication. Okay, where do you start with that? Do you argue with your pharmacist? Do you call the company?
Right.
So we just have a system where our policyholders always call us, and we conference in the right people to help them solve those problems. And that makes it so that people can enjoy the things about retirement that they should get to enjoy and not have to worry about Medicare all the time.
Sure, yeah. And you mentioned you're not in all states. Which states are you not in?
So we are not in, currently not in Massachusetts or New York. However, if you have any listeners that are in those states, I know great agents who service both of those states, so could certainly provide a referral if needed.
Okay, great. Good to know. Thank you. And we'll touch base a bit more at the end about how people can find out more about you and where to go for other assistance and how to contact Boomer Benefits.
Okay.
Cool. So I thought maybe if we can start, the mix of people in the group and watching right now, generally late 50s, early 60s. Some people are getting close to the point where they need to start thinking about Medicare. Some are on it and could benefit from finding out, what could I or should I be doing now that I'm on it. And some people are just starting to research and learn about it. So if you can maybe kick us off by just kind of explaining brief history of Medicare, kind of what it is and what it does.
Sure. So for a very long time, there were people that would work well into their 80s because there was no health insurance for them. And if they retired at a normal age, they would just be without coverage, and then they become a burden to their families. And so not too long after the whole Social Security New Deal thing, then later we brought Medicare into being. And it was signed into law in 1965 by President Johnson. President Truman and his wife were the first policyholders. And back then, Medicare Part B cost $3 a month. It's so funny to me, but yeah, a really good program. But essentially what they did is they created health insurance for people so that they could retire. And going hand in hand with that is they also had Social Security then, so they wouldn't be impoverished during retirement.
Sure.
And back at that time, we had the old Blue Cross and Blue Shield style of policies, and that's exactly what Medicare is modeled after. There's a hospital part and an outpatient part. And although Blue Cross and many other insurance companies have evolved a long way since then, Medicare still handles everything in those two separate parts. So your Part A benefits are your inpatient hospital benefits, and those are the benefits that are provided by that little tax that you see on your pay stub that says FICA. They pull these taxes out of your paychecks, and those go to prepay your Social Security and Medicare benefits in the future. And so the money that comes out of your check all during your working years is put into a trust fund, and then later when you turn 65 or whenever you join Medicare, you then are able to get that hospital insurance. And as long as you or a spouse worked for at least 10 years in your lifetime here in the US and had those FICA taxes pulled out, your Part A benefits won't cost you anything when you sign up for them. And it covers inpatient hospital. Think of it as room and board in the hospital. You're going to have, a semi-private room. You've got doctors and nurses checking on you. If you need a blood transfusion or something gets better, but you're not quite ready to go home and they transfer you to a skilled nursing facility, Part A covers that. And someday, if and when you need them, also covers hospice benefits. So think of that as anything happening in an inpatient setting.
Okay.
And then Part B, the outpatient medical, is all the things that you and I would think of as outpatient medical, like preventive care, doctor visits, lab work. But there's also some things that happen in a clinical or hospital setting that actually fall under Part B outpatient medical because physicians perform them. So things like outpatient surgery or physical therapy. If you're in a hospital setting receiving chemotherapy or radiation or dialysis or oxygen, all of those things fall under Part B. So if you don't have any other creditable coverage, like through an employer that you work for, then you need both Parts A and B. If Medicare is going to be the primary coverage, you can't get away with just the hospital portion. You really need both. Now, Part B, you don't pay any taxes toward that. So when you become, when your Part B becomes effective, the current base rate is $144.60 per month for Part B. So we're a long way from $3 that President Truman paid back in the day. But this is providing your Part B benefits to you, and you'll pay that for the rest of your life. So one thing that a lot of people get wrong is they assume that Medicare is going to be free someday. That's one of the mistakes that we cover in the book. And you're half right. The Part A is technically no premium. It's not free because you paid for it all those working years. Sure. But your outpatient coverage, you are going to pay for that. And some people in higher income brackets pay more than $144.60. So about 5% of all beneficiaries will actually pay more. People in the highest bracket can pay almost $500 a month for Part B. So super important for you to be working with a financial planner and estimating those costs ahead of time, looking to see where your income falls so that you make sure that by the time you retire, you do have enough set aside to pay for Medicare during your retirement.
Sure.
Those two parts are what we call original Medicare or traditional Medicare, and they're the only two parts that you sign up for at the Social Security office or railroad if you retired from railroad. Okay. Part C and D came later, so I'm sure later on in the discussion we'll talk about the couple routes you can go with Medicare. Part C is Medicare Advantage program. That's one route you can go. And then Part D is easily my favorite part of Medicare. It's not beneficiary's favorite part of Medicare because it's quite confusing, but I was in this business before we had Part D. So for 40 years, people on Medicare had no outpatient drug coverage. And Part D came along in 2006, and now they do have drug coverage. It's not perfect. It's got different stages. It has a deductible and a coverage gap that people don't like. But I remember when people were paying $10,000 a year for diabetes medicines. And so Part D is phenomenal that we have it. It's optional. You don't have to enroll into it if you don't want to. But if you don't enroll and you don't have other coverage and you later change your mind, they'll penalize you when you do buy it. And so those are all the little nuances that people need to get familiar with before they turn 65 and join Medicare, so that none of those things come as a surprise.
Okay. And just curious, so prior to 2006, when Part D started, was there any option to buy standalone prescription drug coverage, even away from Medicare?
No, the only thing they had is some of the standard Medicare supplements. There were plans H, I, and J, and each of them came with a little bit of drug benefits. I think if I remember correctly, I think it would cover 50% of your formulary medications up to a total payout of $1,500 a year. Okay. So minimal compared to what we have with Part D now. And as soon as Part D came out, they discontinued those plans H, I, and J, because Part D is obviously quite a bit better. And other than that, people were using discount cards and getting samples from their doctor, and there just wasn't really a good solution.
Yeah. That's too bad. Okay. It's great that they have it, obviously. It almost seems like, why did it take so long to find it in place, right?
Of course.
That's crazy. So you mentioned, one of the sort of misconceptions or misunderstandings is that some people think Medicare is free. Mm-hmm. In some respects, parts of it are, I guess, but other than the cost, what does and doesn't it cover? Because I understand there's some things that you would logically think would or should be covered, but are not covered by traditional Medicare.
Yeah, that's right. So Medicare Parts A and B covers any medically necessary health treatment. So it's obviously going to exclude things like cosmetic procedures, because those aren't medically necessary. Yep. But any medically necessary procedure it will cover, and it covers a whole bunch of preventive care as well. So all the things that you think about: mammograms, colonoscopies, all sorts of different screenings. There's flu shots, pneumonia shots. There's an annual wellness visit and a welcome to Medicare visit. And so there's a lot of that kind of care provided in it. But some of the things that surprise people are Medicare doesn't cover routine dental, vision, and hearing expenses. And question is, well, why in the world would we not have coverage for these things at the time in our life when we would need that most? Right. And the answer is that back in the 60s, when Medicare was created, it was not normal for company health insurance to include dental, vision, and hearing. They didn't have the same kind of understanding back then about how much your dental health can affect your overall medical physical health. Okay. And people didn't live as long, so hearing aids weren't considered a necessary item, because we didn't have people living into their mid 80s and 90s back then as often as we do today. And so those things just weren't part of the picture, and no one thought of them in a way that they do today. So when you come into Medicare, you're going to have to provide for your own routine dental, vision, and hearing. Some of the Medicare Advantage plans have some of that built in, which we can talk a little bit about, but a lot of people just purchase standalone coverage for that. Sure. And then the really big one that people need to know about is long-term care. And this one is always a surprise. I have people in our Facebook group post about it all the time. What do I do about my mom? She's living in assisted living now, and I can't afford this, and she doesn't have any money, and Medicare is saying they won't pay for it. And that's true. So Medicare will pay up to 100 days of short-term care. And that's only if you've had a previous 3-day hospital stay and you're admitted to a skilled nursing facility where you're expected to be in recovery. So if you go to the skilled nursing facility and you're declining, if you have dementia or a host of other things that could cause a decline, that is not meant to cover long-term. So after 100 days, those benefits run out. Okay. And then people are on their own for providing for long-term care. So if you've got a group of people here listening and they're in their late 50s, early 60s, this is now the time in your life when you need to assess, do I have enough money put aside that if I need an assisted living stay someday, I will be able to pay for that out of my personal funds, or should I look into long-term care insurance? I helped my parents get long-term care policies because I see all the people that don't have it, and I see what happens to them. Going through a Medicaid spend down is devastating for the person and the family members involved. So that's one thing that people they assume that this vague Medicare thing that's out there someday is going to cover that for them, and it doesn't. So that needs to be a part of your financial planning.
That's great. Yeah, 100 days isn't a lot, when it comes to long-term care. So all right, we have a question here, Danielle.
Okay.
From Kenan. How about cataract surgery with lenses? I guess question is that covered, and if so, under which part?
So Medicare will pay for, they call it a standard cataract surgery. It's not the intraocular implant lenses, the new fandangled ones that you hear about. They have a standard surgery that they do. And they will also pay for a pair of eyeglasses after that point, a standard lenses.
Okay.
Something to know about that is what Medicare considers a standard lens doesn't have anti-scratch coating or the blue light blockers. It's not you can't say I want the no line bifocal. Right. They're going to be a very basic set of glasses. And so when you go to have those filled, if you add those things to your glasses, those are things that you would pay for out of pocket.
Okay. Got it.
Yeah.
Another question here from David. Danielle, do you anticipate a fix for the 5% that you still have to pay for Part D coverage when you are at the catastrophic level of paying for drugs such as expensive cancer treatments?
Yeah, not in the near term future, but we know that it's been introduced into Congress before. So one of the things about Part D, the best part about Part D, the number one reason to buy it is there's a catastrophic coverage limit that helps to stem the bleeding if you get to a certain point. And for most people, in 2020, I think that limit is $6,350. So when you, out of your own pocket in a calendar year, between what you've spent and what discounts have been given to you in the coverage gap by the manufacturer, when those two numbers total $6,350, I think that's the number. I'm getting the 2021 numbers mixed up in my head, so it's close. If you reach that point, the $6,350, then after that, your drugs go to 5% is what you pay, and the insurance company covers 95%. But knowing that for some people, if you have a very expensive drug, 5% can still be a lot of money. Right. And so there is some discussion around whether there should be a actual hard cap on that, but it's not something that I have seen any recent big moves on from the current Congress or legislature. Okay. So I believe it'll be floating out there for a while before we fix that.
Sure. And yeah, it is $6,350. I have a chart here of my 2020 limits, and
good
great memory. Another question, this one more, I guess, about the business of Medicare insurance. So when I looked at this is from Cindy, when I looked at Medicare Advantage last year, I tried going through a Medicare broker, but although they handled Medicare Advantage policies from a lot of different companies, they did not handle Blue Cross, which is what I ended up going with. Are there normally some companies that Medicare brokers don't handle?
Yeah. So with Blue Cross specifically, the reason that happens is, let me just give you an example. If our agency is contracted with Humana and we can sell their Medicare Advantage plans in any state, and we go through one set of training for that, and that gives us, and as long as we're licensed in all of the states where we want to sell that product, we can sell it. And so it's easy because these Medicare Advantage companies, we have to go through certifications and pass exams on those every year to be able to work with those products. Okay. And so if you have a company with a national contract like that, you contract once, you go through one set of training. Blue Cross divides their companies up by states. And so if someone was a Medicare broker like us, that would mean 50 or more, we don't know how many states they have these products in, but like I'm licensed to sell Blue Cross and Advantage plans here in Texas, but I don't go through 49 other sets of training to be able to offer that in all the states because there just literally wouldn't be enough time. So with that particular carrier, that's why you see that. But also I can tell you just here in the Dallas-Fort Worth area, we work with most of the large carriers who have the biggest market share for Medicare Advantage. They have a lot of funding, the benefits are good. But in most areas, you will find several carriers that are smaller or maybe local. They might be owned by a local physicians group. We have one of those in Fort Worth.
Okay.
And so it's up to the agent whether they want to take the time to get licensed, appointed, and contracted and go through all the certifications to add a carrier like that. They have to gauge how much interest there might be from the public to make it worth the time that they would invest.
Okay.
And so that's probably why sometimes you're going to run into where a broker may be a great broker and they just don't have that one carrier in their bag.
Okay, that makes sense. Question from Kathy. What types of ailments are such that if you have them, you won't easily be able to change providers due to not being able to pass the underwriting?
Yeah, I love this question. So on our website and also in the book, there's some discussion around this. And there's a lot of anxiety that people have when they start off. You get with Part B, when you come into Medicare, you've got a 6-month one-time open enrollment window to pick any Medigap plan you want, and no health questions asked. And then that goes away. And after that, in most states, you don't have that window anymore. So changing from one Medigap plan to another, either due to a rate increase or you decide you want a plan G instead of a plan N, doing that kind of changing in most states requires you to go through medical underwriting, and the carrier can look at your health conditions, look at your prescription history, and accept or decline you. Okay. So the way that I have it broken down, I think in the blog post is, if you have minor health conditions, it's a likely approval. So, if you take a thyroid medicine and a blood pressure medicine, and you've got a little bit of maintenance meds going on, and, you maybe go in once or twice to the doctor a year, they don't care if you had the cold or flu last year, and they're glad that you're managing your blood pressure with the medicine. You're going to get covered, pretty well. But if you have a chronic surgery or anything pending, that is going to be likely a decline. So let's say you had a knee replacement and you are still going through physical therapy and you have a number of follow-up visits scheduled. You need to get through all those visits, and then there's got to be a period of time usually that's clear afterward, because the carrier doesn't want to inherit medical care for a surgery that was done not through them. So anything pending that you have, you always want to wrap up all your follow-ups, all your physical therapy, get that done before you start a new application. Chronic health conditions are the ones that will knock you out the easiest. These are going to be things that are treatable but not curable. So autoimmune disorders like RA, multiple sclerosis, lupus, Hashimoto's, thyroid kind of disorder, if you have been diagnosed with Graves' disease, Parkinson's, a lot of breathing disorders. So COPD, severe asthma could be something that knocks you out, emphysema. These are conditions which you can treat, but which are never going to fully, there's not a cure for them. Those are things that typically are going to knock you out. If you're currently undergoing cancer treatment or you've been in the hospital in the last 90 days in an inpatient setting, those are things too that can knock you out. Now, a broker though, like us, we will have an idea of which carriers may be a little more lenient on some things than others. So for example, you have atrial fibrillation, that's going to be a decline with most carriers, but there's one where sometimes, depending on the health of the other health with the person, they'll let that through. And so we know there's one carrier where we might be able to get you approved. Diabetes is another one. And if you're taking more than 50 units of insulin, it's probably a no-go. But if you just take a couple of pills for diabetes, it depends on, what's the dosage, how recently have you changed the dosage to manage it, and do you also take blood pressure and cholesterol medicines? So it's more of a kind of a big picture look. So if you feel like you have sort of a condition like that where you feel like you're in pretty good health, but you do have this, it's a good thing to have a discussion with the broker just to find out, are there any carriers that they know that might be lenient on that? Are there carriers where you might be able to be accepted, but you would get a rate up, meaning they increase your rate because they're going to cover the condition? And those are the kind of things that we can help you pick through. We can also tell you, hey, you know what? That's not going to get covered anywhere, and you need to stick with what you've got.
Okay. So we've got a handful of questions coming in about what is Part C and also what's Medigap. So I'd like to step back and kind of discuss those at a high level. But real quick, just piggybacking on this, Nancy asks, is type 2 diabetes on that list? Is that an
Yeah.
automatic denial, or it depends on how much insulin you're taking, like you said?
It's going to depend on it. Yeah. So if you're
Okay.
taking more than 50 units of insulin, it's almost always going to be a no. If you're
Okay.
taking less than that, or you're just taking some management meds, then that might be approved. One carrier that we work with, which is United Healthcare, in a lot of areas, they will take certain conditions like that, but they have different rates that they might apply.
Okay.
And so, we might talk with someone like that, take a look at the couple of carriers. If we try you on one and you get declined, well, we could back up and go to this one, but it might cost more. So those are all things that your broker would discuss with you and determine, what's the best route to go. Or if we really just think it's not going to happen and you don't want to waste your time, we can be honest with you and say, hey, we see this get declined all the time.
Sure. That's great info. Thank you. So, a handful of people asking about Medigap versus Advantage. So, yeah, I guess maybe just to sort of set the stage with Parts A and Part B, those are the two that you have to have, and A is hospital, B is regular doctor visits, et cetera. Those don't cover everything. In addition to the premium you pay, there's still going to be co-pays, deductibles, and out-of-pocket amounts, correct?
Yeah.
So I guess with that said then, what are the options to, well, I guess one option is self-insure and just wing it and pay for the rest if you have to above and beyond the base. But what are the other options there are to get additional insurance on top of the base Medicare?
Sure. So Medicare has deductibles, copays, and coinsurance, just like coverage that you have when you're under 65. You don't go to the hospital and it's free. You have a deductible that you pay. Medicare has the same. There's a $1,400 deductible on Part A, and then there's daily hospital copays that can get quite expensive if you're in there over 60 days. And your hospital benefits run out after 150th day. We want more than that. There's skilled nursing facility coinsurance, blood transfusion coinsurance. And if you don't want to pay those things, you want to have something in place to help with them. On the Part B side, Medicare only covers 80% after you first pay a small annual deductible, but the other 20% goes on forever. There's no cap on it, no end. And so that's not a big deal for a doctor visit. It's a devastating deal if you have 8 weeks of chemotherapy.
Sure.
That 20%, the insurance we're used to under 65, we have a deductible and then an out-of-pocket maximum that we could hit. And when we hit that out-of-pocket maximum limit, we're done for the year. The carrier pays 100%. Medicare doesn't come with that. Okay. So the most important thing that a Medigap policy will do is cover that 20%. And there's 10 standardized Medigap policies. So the first route that you can go, we're going to talk about two routes. The first route that you can go is Medigap, which is also called Medicare Supplement. Same thing, just two different terms. Okay. That is exactly what it sounds like. It supplements Medicare to cover the things that ordinarily you would have to pay, like those deductibles and coinsurance that I just told you about. Okay. So you could purchase a plan that has a little bit of coverage or a lot of coverage. By far, the most popular seller is Plan G, which currently has the most coverage for anyone new to Medicare on or after January 1st of 2020. Okay. And it covers everything except for the $198 Part B deductible. So you go to the doctor, you pay nothing. Go to the hospital, pay nothing. Knee replacement, nothing. Chemo, nothing. I could go on. If you like that idea of that kind of coverage, where when you're in the hospital, you're not worrying about what's coming in your mailbox when you get home, that coverage provides a lot of peace of mind. Medigap plans cost more than Medicare Advantage plans, but they also have a lot less cost sharing on the back end. For example, the Plan G that I just told you about. And the other part about Medigap plans is you have freedom of access to see any of Medicare's providers nationwide. So we have over 1 million providers. You don't have to pick a primary care doctor, and you don't have to get a referral to see a specialist. And the important thing about this that I want everyone to think about is, I live here in Texas. We have MD Anderson down in Houston, arguably one of the best hospitals in the nation, if not the world. If I got cancer, I would at least want to consider treating there, even though I live in Fort Worth. If I was going to get the best oncologist, I would want to have access to that hospital. If I go with original Medicare and a Medigap plan, I can absolutely treat there, and they're going to take my coverage. So that is one thing about Medigap plans that is really awesome, is that free access. It's great if you travel in the US. It's great if you snowbird, if you have a lifestyle of RVing, but you're going to pay more for all of that freedom and that really sure coverage. Along with that, Medigap plans were created in the 60s along with Medicare. So back then we didn't have Part D. So Medigap plans don't include drug coverage for outpatient. They cover inpatient medications and chemo and infusion medications,
Right.
but they don't cover. So you have to add that standalone Part D drug plan. So you've got Medicare premiums, Medigap premiums, Part D premiums.
Yes.
Okay. But you're going to have the Cadillac coverage if you go this route.
Yeah. Okay.
Yeah. Now, not everyone can afford that. So here in DFW, a female turning 65, non-smoker, might pay $100 a month for a Plan G. In Florida, she'll pay twice that. And in Connecticut and some of these other states that have either continuous open enrollment or their healthcare is just more expensive there than it is here. So, someone might come and look and say like, well, I don't want to spend $300 a month on healthcare. And I'm also going to have rate increases over the years with my Medigap plan. What is a cheaper option for me? So it used to be just Medicare and nothing else. Well, then you risk that 20% forever. But the Balanced Budget Act in 1997, they created Medicare Advantage. Back then it was called the Medicare Choice Program, but it's what we know as Medicare Advantage today. This is a way to take those Part A and B benefits, and instead of getting them through the federal government, you agree to get them from a local private insurance company that has a network in your area. So you have to understand you're giving up some of your freedom of access to do that. And that's not necessarily a bad thing. You just want to be aware if you're on a plan that's an HMO, that means a closed network HMO would have no coverage outside of the network except in emergencies. Most HMOs, you've got to pick a primary care doctor. You have to see that doctor for a referral for a specialist. I give some examples in some of the blog posts and in the book about, how this could interplay in a health situation that you might encounter. But on the other hand, a lot of us are used to that, right? We've been on HMO and PPO plans, so you might be fine with it. These cost less. Now, you have to still have Medicare Part A and B. A lot of people think you can get out of paying the Part B premium if you join a Medicare Advantage plan. That is not the case. You're going to be on A and B forever and paying that Part B premium until you go home. That is the way it goes. You're going to have that P premium forever. But in some areas, you can find Medicare Advantage plans, especially in urban areas. You can find Medicare Advantage plans with very low premiums, and some of them will have what we call a zero premium, which means you don't pay anything at all to sign up for the plan other than what you're already paying for Part B. So you don't pay anything for the plan. Now, the plan gets paid by Medicare. Medicare is paying them $1,000 or more a month to manage your health risk. And if they can figure out how to deliver those benefits to you for less money than they're taking in from Medicare and make a profit, that's a win for them. And the way that they control those costs is through a network. They're limiting a little bit where you can go for care. And you're going to have more things like prior authorizations. Your doctor is going to have to provide some proof when you need to have something covered. So these are just standard hassles that come with networks, HMO, and PPO. If you're worried about that a little bit, let's say you're listening to this and you're like, well, I would want the option to go where I want for cancer. You could look at a Medicare Advantage that has a PPO network. These typically cost a little bit more. Your cost sharing will be a little bit more, but you can go outside the network at a higher cost to yourself. So with the Advantage plans, cheaper upfront, but you have more copays as you go along. So you're going to pay maybe $10 to see your primary care doctor. It might be $50 every time you see your specialist. If you go in the hospital, it might be $200 a night. If you have an ambulance ride, it might be $300. And if you have cancer and you need chemo, it might be 20%. The difference is Advantage plans have a out-of-pocket limit to cap that, whereas original Medicare's 20% does not. So in 2021, Medicare Advantage plans, they can set their out-of-pocket limit no higher than $75.50. So what that means to you is if you enroll in a Medicare Advantage plan and it has a $75.50 out-of-pocket max, let's say you do have cancer and you do have to pay 20% for that on this particular plan. You're paying 20%. If you spend $75.50 out of your pocket doing that in 1 year, then you're done. And the Medicare Advantage plan pays all your A and B costs for the rest of the year until everything resets in January. So This plan, a lot of times Medicare Advantage plans, they appeal to people if it's going to be a stretch to pay a Medigap premium. Sometimes an Advantage plan looks really good. Hey, maybe you're relatively healthy. You take a few medications. You go to the doctor a couple times a year. You don't want to spend $300 a month for all of this. You could pay for Part B, $144.60, and have a zero premium Medicare Advantage plan that, by the way, includes a built-in Part D drug plan. Now you're spending, quite a bit less than you would have paid for Medigap. And so you're making a judgment call there. Am I okay to spend less upfront knowing that I'm going to have more copays on the back end? And this is the kind of conversation that a broker like us would have with you, where we would say, okay, tell me about your medical usage. Tell me how often you go to the doctor. If someone tells me they go to the specialist 3 times a month, the Medigap plan is hands down a winner, because they're going to spend $150 in copays on an Advantage plan on top of everything else. So we would be able to point those things out. You want to dig into the details. If you can find a Medicare Advantage plan in your area with a $4,000 out-of-pocket maximum instead of $7,550, that might really sway you. And down in Florida, the benefits in those things are unbelievable. That's so competitive, that market. Pretty much zero copays on a ton of stuff, and they, throw in the baby with the bathwater. Everything else is included. And the other thing about Advantage plans is they can include what we call ancillary benefits. So they could offer you a little bit of routine dental. Maybe they pay for 2 teeth cleanings a year, but you use this network. They could have a little vision benefit. Maybe they give you a free eye exam and $100 credit toward glasses, or a 20% discount on hearing aids. They can even throw in things like gym memberships. So there's a lot of things about them that make them really attractive. And I would say nationally, about 1/3 of all beneficiaries choose Medicare Advantage. They're very popular because of the price. In my agency, probably 10 to 15% choose them. But the ones who do are quite happy with them. And the reason I think the percentage is lower is we tell people all the things I'm telling you, the things that you would maybe, if you didn't know and you found it out later after you were on the plan, that you'd be devastated to find out. We let everyone know up front. These are the pros and cons. And if all of that works for you, let's say you're the kind of person that would take that $100 a month that you would have spent on Medigap and put it in a rainy day fund. And then 5 years down the road, you have a year with your Medicare Advantage where you've got a lot of health spending. No big deal, because you put that money aside in this little fund that you only have for medical. That's my advice, is to, if you're going to do the Advantage plan, make sure your doctor's in the network. Make sure your drugs are covered by the formulary. Put some money aside for a rainy day, because someday you're going to have a health event and you're going to have more spending on that Advantage plan. And at that time, you might think, hey, I'll leave this plan now and go back to original Medicare and just pick up the better coverage. Well, it doesn't work like that. Your health condition might cause you not to be able to get that more comprehensive coverage. So that's a really long-winded answer, but I wanted to make sure I cover all the things, because these are the things that your audience really needs to know so that they can decide if an Advantage plan is okay for them.
Right. So you're saying just because Chuck Woolery or Robert Goulet tells me on TV to get one doesn't mean I should? It doesn't.
That's right. When you see Joe Namath up there, let me tell you, Joe's getting a lot of money to sell that Medicare Advantage plan to you. And you need to dig into the details. Make sure it works for your lifestyle. Make sure you know all the facts, and be sure that your doctors are in the network.
That's great to know. So it sounds like, sorry, I'm just copying and pasting some questions here. They're coming in fast and furious. I want to make sure I don't miss them. And that's what sounds like it's great about your agency, right? It's not as simple as you see a commercial on TV or you get this cluster of mailings telling you to buy an Advantage plan. Part of what your agency does is the education, like you said. The right choice will be specific to you and your circumstances and where you live and what doctors you see, et cetera. That'll determine what plan is best, right?
Absolutely. And we also do the heavy lifting. We get the names and numbers of your doctor's offices and the prescriptions that you take, and we do the checking. We make sure they're in the directory. We call their offices, make sure they're in the plan, to accept the plan. Do they plan to still accept it next year? Because that can change. And that's something that you should do. If you're not working with a broker, you definitely want to do that. When you work with a broker, typically someone like us is going to help you with some of that upfront legwork to identify which plans you might even want to begin looking at. The first thing you can do is talk with your doctor and say, hey, do you take original Medicare? And if the doctor says yes, that means any Medigap plan that you have, no matter which insurance company you buy it from, will pay that doctor. All you have to do is say, do you take original Medicare? The next question needs to be, do you participate in any Medicare Advantage plans? And if so, which ones? And then they can tell you, oh, we're in these 3. And you need the exact plan names because those networks are all different. And a lot of people don't know how to ask the right questions. And that's where sometimes they can end up in a plan that they thought their doctor would accept, but actually doesn't.
And that's great advice. And that was something that I actually really liked in your book. About and I didn't know that. So people just think of Medicare generically, and rightfully so. A lot of people aren't, it's an incredibly convoluted system. If you have an Advantage plan, you assume you have Medicare. You go to a doctor and say, or you ask a doctor, do you take Medicare? He or she says yes. You think, okay, I'm good. You go to that doctor, come to find out they don't take Medicare Advantage, the specific Medicare Advantage plan you have. They take the original Medicare.
Yeah.
And oops, guess what? It's not covered now. So
that's right. Or they take the PPO, but not the HMO. And you didn't know to ask that, and that's of course very upsetting.
Yeah. No, that was, I thought that was really, that hit home with me. Not that I'm on Medicare, but that one really stood out to me in the book. I was like, wow, that's Medicare isn't Medicare. It's not the same thing, unfortunately.
Yep. Good point.
All right. We got a whole bunch of questions here. Let me just start picking through some of these.
Okay.
Beth asks, on Part D, why are some drugs in different tiers depending on what company you go with? Shouldn't the same drug be in the same tier no matter which plan you have?
I wish that was the case, but unfortunately, the carriers can put the drugs in any tier that they want. And typically, there's going to be 5 tiers: preferred generics, non-preferred generics, preferred brand, non-preferred brand, and specialty.
Okay.
But the carrier can choose to put a brand name drug in a generic category. So they can take a generic drug that's really cheap and they can stick it in tier 3 if they want to. So it all depends on what they're paying, what their cost is for the manufacturer of the drug and what it's costing them. And then they can slot it into any tier, which is why, of course, whenever you're choosing a drug plan, go to mymedicare.gov, sign up for a personal account there, put your medications in, and let the tool crunch the numbers. It will tell you exactly which plan out there is going to give you the lowest overall out-of-pocket cost.
Great. Okay. Question from Jackie about HSAs. And HSAs come up a lot in the taxes and retirement group here. Can you just use your existing HSA funds to pay the out-of-pocket expenses that Medicare doesn't cover instead of getting a Medigap plan?
Yes. So you can use your HSA to pay not only for copays, co-insurance, deductibles, you can even use it to pay for your Medicare Part B and D premiums. Okay. So if you have a lot of money set up there, you could do that. I don't think I would choose that unless that HSA fund is huge, because if you go through paying 20% of something like a hip replacement, that's going to be a heck of a lot of money that will hit your account there. And, you may not be able to find coverage after you develop a health condition. So you want to be careful with that. Okay, great. And fun fact, I believe HSA funds cannot be used to pay for Medigap premiums. That's true. So Medicare, but not Medigap. Yeah. Okay, cool. Question from Kathy. Are there things like shingle vaccines that you should get that you should plan to get taken care of while on employer insurance versus waiting for Medicare? Yes, I highly recommend that you get the shingles vaccine before you go on Medicare, because Medicare has some vaccines that are covered under Part B, and those are great. They're covered at 100%. Your flu vaccine, pneumonia, I think there's hepatitis. That one might be covered at the 80-20. Okay. But for whatever reason, the shingles vaccine they cover under Part D, your drug plan. Okay. And Part D drug plans, a lot of them have a deductible up front. In 2021, that deductible can be as high as $445. So those 2 shingles shots, they are around $180 to $200 a piece. And if you have a deductible up front and you haven't met yet, you're going to spend into that. Right. And even when they do cover it, it's usually in a tier 3 or 4. So people pay a pretty penny for that, even with the Part D coverage. If you can get it on your employer insurance before you head over to Medicare, great idea. Definitely do, yeah. Yeah. Okay. Ned asks, just turned 65, still employed, and in quotes, greater than 100 employees, and covered by insurance. I'm not planning on signing up for Medicare until I retire in a few years. Do I need to notify Medicare now of my plans? No. So in your situation, if you're not contributing to an HSA, I would sign up for Part A, because it can hurt you It's going to cost you nothing as long as you've got those 40 quarters, which 99% of beneficiaries do. And it could help you by paying secondary to your group insurance if you have an inpatient hospital stay. I've seen it kick in and save people quite a bit of money, especially if your work plan has a pretty high deductible. Yeah. It can't hurt you. And then you would just delay the parts B and D until you retire. Now, if you're contributing to an HSA or your employer is contributing to an HSA, then you can't enroll in Part A because it's considered other insurance. And that's a no-no with the IRS. Right. But unless that's the situation, no need to skip the Part A for now. But you're not required to tell Medicare anything. As long as you're not taking Social Security benefits, they're not going to automatically sign you up. You enroll yourself at 65. Yep. Unless you're already taking Social Security, then they auto-enroll you.
Okay, good to know. Suzanne asks, can an Advantage plan drop you if you hit the max in 1 year?
No. So important to know that maximum is to protect you, and both Medigap plans and Advantage plans are guaranteed renewable. They cannot drop you for anything other than failure to pay premiums, or if the plan folds. We see that happen sometimes. The plans just fold up shop. And if they do that, you're going to have a special election period to choose something else. But no plan can drop you for a new health condition.
Okay. So that's good to know. They can't drop you, but the next question is more about, can you drop them? Canon asked, and this was asked by a few people, can I switch between Medigap and Medicare Advantage on an annual basis?
So not really. It's a yes and no thing. And I love this question because it's really important. So let me explain the direction that you can go. If you have a Medigap plan, that plan does not have an annual benefit change. There's no change in the core benefits for a standard Medicare supplement. So they are not part of this annual election period that we're in right now. The annual election period is for changing your drug plan or your Advantage plan, because those two things do not have health questions. That's why there's an election period to change them. But your Medigap plan has nothing to do with the open enrollment. So you can't use that to get into a Medigap plan with no health questions asked. A lot of people will say, can I start with the Advantage? It's cheaper. And then if I do get sick, I can switch back to the Medigap, right? Doesn't work like that. So going from Medicare Advantage back to original Medicare, no problem. You can do that during the annual election period, but getting the Medigap plan requires approval. Now, if you're in the Medigap and you're switching to Medicare Advantage, no problem at all. You can disenroll from the Medigap plan anytime you want. You enroll into the Advantage plan during the annual election period in the fall or another valid election period. It's easy to go that direction. It's harder to go back the other direction because you're going to have some underwriting to get that Medigap plan in most states.
So that's a real important point to know, right? So when you're 65 is when you can first sign up for Medicare, and it's what, 3 months before and 3 months after the month of your birth?
Yes.
So that's parts A, parts B. Now Medigap, if you choose and you want a Medigap, how and when do you sign up for that initially?
You're going to have a 6-month open enrollment window starting with your Part B effective date. So whenever you first enroll in Part B, you'll have 6 months to sign up for any Medigap plan you want with no health questions asked. And then that's gone. You're not going to have any other opportunity to buy a Medigap plan without health questions unless you canceled Part B and went back to work for a few years and then re-enrolled in Part B later. You might have a second window in that scenario, but for most people, you have a 6-month chance. So if you think you want Medigap coverage, if you have a certain health condition going in, you think that's the coverage you want, you don't want to miss that golden opportunity to get it. Now, Medigap plans do have rate increases from year to year. Rates are going to go up on that like they do with auto insurance and anything else. So you may be stuck with that Medigap plan for the long term, and that's something you want to talk with your broker about so that we can look at which carriers in your area have the longest rate increase trend normalcy. Some carriers have rates that go up and down, and there are other carriers where the rate increases happen, but they're pretty steady and manageable. And we want to look for those for you because you might be on that plan for a long time. Okay.
So that's a big note, right? Like, everyone pay attention. If you want a Medigap plan, the time to do it is when you're first 65 and enroll yourself in Medicare, Part B for the first time. Because doing it then, there's 0 questions asked. You can get whatever Medigap policy you want, even if you have horrendous amount of underlying conditions, correct?
Yes.
Okay. If and when you ever choose to switch or you drop that and whatever, that's when you have to undergo underwriting. And that's what we were discussing before, where there's certain conditions that could knock you out or make you ineligible for that policy, correct?
Yeah. And
Okay.
if you're going from a Medigap plan into a Medicare Advantage plan for the first time you've ever tried Advantage, they actually give you a 12-month window to change your mind and go back to the Medigap plan without health questions. So
Okay.
it's a little bit of a try before you buy. The problem with that is that everyone loves the Medicare Advantage plan until they get sick. So if you don't get sick in that first year, you're probably going to stick with the cheaper coverage. And then down the line, what always happens, and I just know this from the calls that we get, is it's when people start to have a health condition and they're spending a lot of money on Advantage plans for all these copays and all these fixes, because you'll have a copay for lab work, you have a copay for an x-ray, you have a copay for, these type of thing, and people start to get nickel and dime to death, and then they're like, wow, I want to go back to this other coverage that I had before. I never got any little copays on that coverage. And, that health condition that's causing you to have all the spending on the Advantage plan could be the thing that prevents you from getting back to the Medigap. So again, that's why I like the rainy day fund, because then you're not going to panic if you have some health conditions for a period in the future.
Yeah, that's a great point. Question specific to Plan G, sorry. Does the Medigap Plan G cover vision, dental, and hearing aids?
No. So Medigap plans can only pay on something if Medicare itself first approves the claim and pays its share. And since Medicare doesn't cover routine dental, vision, and hearing, the Medigap plan can't cover those things either. So we have standalone policies for that. Our agency offers one. It's called the DVH, dental, vision, and hearing. No networks, and you can use the coverage however you want. Maybe one year you spend it all on hearing aids. Maybe another year you do it on vision. And there's tons of standalone vision and dental policies out there. You could just Google senior individual dental and you'll find a lot of options for that. So you would be adding that separately if you went with original Medicare and a Medigap plan. Now, keep in mind, Medicare does cover medically necessary treatment of your eyes. So if you have glaucoma or cataracts, that's going to be covered like anything else. It's just the routine part, going in and reading your little chart and getting your next prescription. That's the part that typically is not covered by Medicare.
Got it. And to the extent, if you get an Advantage plan, then those things may be, depending on the plan. So those
Yeah.
Okay.
So always pick your Advantage plan for things that are important medically to you. You want to have the doctors in the network. If you've got a family history of X, Y, or Z, you want those benefits to be good for whatever that thing is. But then let's say you narrow it down to 3 plans and your doctors are in the network and everything else looks good. Then you might look between them and say, okay, who has the best ancillary benefits? Which one has a little more dental? Maybe one has a gym membership and the others don't.
Yeah.
Keep in mind, all of those things with Advantage plans, one area that they're unlike Medigap plans is those benefits on that Advantage plan, those change every year. So if you join a plan and you love the dental benefit or you love the vision benefit, make sure you use it quickly, because the following year when they change and they send out their notice to you about what they're changing in 2021, sometimes some of those things get dropped. And so you want to make sure you always choose your plan for your medical needs. The ancillary, you want to consider that gravy. And if there's a benefit that you really like and you know you need to use, when you get on the plan, go ahead and exercise that benefit and get the glasses, get the teeth cleaning, whatever it is that you joined for that you liked about that ancillary plan. Get those things done, because every year in September, they're going to send you a notice telling you all the things that are changing in your Advantage plan for the next year, and they could drop anything. So you want to use those benefits while you have them.
That's good. Just random comment. Mike says, very happy with my Advantage plan. 0 premium, covers basic dental, vision, and the few drugs I take. HSA pays a few copays, but I am pretty healthy. I guess that's a big caveat, right? But I am pretty healthy.
He sounds like a great fit for that kind of coverage. And I would say that in our agency, the people that choose Advantage plans, a lot of them are in that same scenario. They're pretty healthy and they might be that way for years.
Yeah.
And so they don't feel like spending all that money on a Medigap plan, and Advantage plan is a really great fit.
Yeah. Here's a good one. So what happens to Medigap plans when you move to a different state? Are you then required to answer medical questions?
No, your Medigap plan covers you nationwide and it will move with you, but the rate will change based on your new zip code. So if you're going from Florida to Texas, you're going to love the rate change. But if you're going to Texas from Florida, you will not be happy with the rate change.
So they can drop you and what they cover won't change, but the amount you have to pay.
Yes.
Will change. Okay, great. Not directly related to Medicare, but the standalone policy you have for vision, dental, and hearing, can you get that prior to age 65?
That particular plan I think is built for Medicare beneficiaries. I don't know off the top of my head if they sell it for under 65. I don't think so.
Okay, good to know. I'm just looking here, other questions. I think we might be caught up on the questions. All right, so that leads me to like we're in the, what's the technical term, annual election period or open enrollment?
Mm-hmm.
What do you call it? Okay.
Both terms are used. Yeah.
Okay. So every October 15th to December 7th is the annual election / open enrollment. So what exactly can you do during that period?
Yeah. So you can enroll in, change, or disenroll from a Part D drug plan or a Medicare Advantage plan. Okay. And what you need to know, and because most people have one or the other, right? Because if you did Medigap, you have a standalone Part D drug plan. Yeah. And if you have an Advantage plan, you've got an Advantage plan. So in September, your carrier will send you a notice telling you what's changing. They can change your premiums, your copays, your deductibles, your pharmacy network, your doctor network, the drug formulary, copays, tiers, all those things can change. And I usually find that the differences are not huge from year to year, but when you get the packet, it comes in the mail in September. Open it up. It has a side-by-side reckoning. It's literally telling you this copay is changing from $5 to $10. Exactly. Anything that changes, it's all listed at the top there. Okay. And the thing you really want to look for that to me is the most concerning is if they're dropping one of your medications or changing a tier on your medications. So, you don't want to be taking a $400 diabetes medicine that's covered now, and then you don't read your packet, right? Because who is excited about getting a big Medicare packet in the mail in September? You're not going to be excited about that. You're going to throw it over there and other mail's going to bury it and people don't look. And then in January, you're going to go try to fill that drug at the pharmacy that you used to pay $40 for and now they want $400 for it. Well, in January, it's too late to change your drug plan. So, spend a few minutes looking over that. It's pretty easy to see. Most people look at them and it's like, these are okay. I think I'm good with this. And they just let everything auto renew. You don't have to do anything at all. Yeah. But boy, if something is changing and then you want to use that to change. And with Part D, they change a lot. So okay. you might just do a search once a year. I tell people go to mymedicare.gov, enter it in your portal, look to see, is the plan that I'm on, even though I like it, is there another plan out there that would save me money on my prescriptions next year? It doesn't hurt to look. And sometimes you'd be surprised at the savings you might find.
Yeah, that's good. Here's a good one, Danielle. I hadn't thought about this before. Do married couples make individual choices or are there family plans?
No family plan. So with Medicare, everyone's an individual. You'll each pay your own separate Medicare Part B premium that gets deducted from your separate Social Security check. And you will also have your own plan. Now, with Medigap plans, some of them have a household discount. So if you and your spouse sign up for the same plan, maybe you get a 5% or 7% break on your premiums. Okay. That can happen, but you still would have two separate plans and two separate policy numbers. So it's totally okay if one spouse chooses Advantage and the other one chooses Medigap, or two of you choose two different Medigap plans or two different Advantage plans. You can choose the ones that work best for you. Don't feel like you need those to be the same because you might miss out on some savings by trying to make one plan fit one person when it's really better for the first person.
Okay, that makes sense. And that question was from Vanessa, by the way.
Okay.
And Cannon asked, why is Medigap different based on zip code?
So Medigap plans price their policies based on the zip code you live in and the cost of healthcare in that zip code, your age, your gender, your tobacco usage, and the household discounts that are available. So treatment in some areas is just more expensive than others, and they base them on the zip code.
Okay, good enough. Question from David. It's my understanding that Boomer Benefits would be able to recommend the Medigap carrier that has the least amount of premium increases based on knowledge of the market in your area. Is this correct?
So what we can do is we have a software, and it can pull up the rate increase histories for carriers, and it will show us the trend on those rate increases. Now, two things. One, sometimes there's a carrier that's new. So one of the games that these carriers play is there's the big carrier, let's just say Aetna. Well, they'll come out with a Medicare supplement, and then a bunch of people buy that plan. They start having claims for a few years, and the rates start to go up a little bit. Well, now that plan is not getting a lot of new business, right? Because it's paid out claims and it's had some rate increases. Okay. So now they'll use one of their subsidiary companies to roll out a new, cheaper Medicare supplement, and the same thing happens. And so they all do it. Not all, but most of them play this game where every few years they roll out a new block of business, and it's the same umbrella company, but underneath there is a separate little subsidiary, and that happens. So when that happens, that new subsidiary company will be able to tell you the rate, but it doesn't have any rate history. So it's only been out for a year or 2 years. We can tell you what the rate increase was last year, but it might not have the longevity of rate and history that you would get from a carrier that doesn't do that, say like United Healthcare or Blue Cross. Yeah. That is one thing that you can't predict. You're going to be looking at some carriers that might have a great rate now, but we don't have as good of a projection on the history. Yeah. And then the second thing is crystal ball. You never know. There was one carrier this year, I won't name any names, but they've been very consistent for years, and then just blew everybody out of the water with a huge rate increase this year. I mean, we just couldn't believe it. And it's interesting to note that those carriers, they can't just arbitrarily pick a rate increase. They have to go to the Department of Insurance and show them the claims that they incurred to justify a rate increase that big. So that tells me somewhere along the line there was an actuarial problem where someone didn't really judge the losses just right, or maybe they didn't underwrite as well as they could have, and some unexpected claims were incurred to justify a rate increase that big. So although your broker can give you we can give you all the data that we have, you have to know that you're choosing a carrier, and sometimes even when you make the best choice that you can, there could be a rate increase that you just weren't expecting. And we see that from time to time. Okay.
Looks like we got one more. Let's take one more comment / question here, and then we'll let you leave us with your final words of wisdom. Big things to keep in mind, pitfalls to watch out for. Cody asks, with lots of marketing and spam mail, which documents should you expect that are legitimately from the administration? Is the Medicare and You booklet mailed out to individuals nearing age 65? I guess he means, is that legitimate from the administration?
Yeah. So I don't think they mail out the Medicare and You handbook to everyone anymore. I want to say it's only to people that are already on Social Security, and the rest of you can either buy it on Amazon or you can download it from the Medicare website, which is what I would recommend because that's free. Okay. But yes, that's legitimate. That's produced by CMS. So I love this question because, right, you get this huge stack of mail, and people keep that stack because they don't know what's legit and what isn't. I've had them bring it into our office before, and it's big. Like, they have a lot. So you're getting postcards and flyers. So you want to look for anything that comes from Social Security or CMS, which is the Centers for Medicare and Medicaid Services. Documents that come from the federal government, those are things you want to look at and determine, do I need to keep that? But everything else that you get from all the carriers that I've mentioned, those are just solicitations, and they're kind of unnecessary for you to keep because you're going to use the plan finder in your portal to determine the drug coverage that you're going to choose, and you're going to have a broker that helps you, hopefully with Medigap or Medicare Advantage, and providing you a lot of data. Now, maybe you have a plan in there, they sent you a postcard and you really like the sound of that one, it sounds good. Great, bring it to our attention and we can make sure your doctors are in the network, etc. But most of that stuff, you can just toss it in the round file.
It's interesting. Insurance companies must have really slick marketing departments because I've seen lots of commercials and stuff around this time of year. And it looks official. It'll be lots of red, white, and blue on the screen, and somebody in a suit. And they make it look like it's something from the government, but it sounds like that's all just noise from marketing departments, right?
It is. There was one on television last night, and I just couldn't believe it. I was actually laughing listening to them, and they were like, 0 premium, 0 everything, red, white, and blue, free dental, free vision, and we're going to pay for this for you, and you're going to get money back. And it sounds like this amazing thing. Well, it's usually a Medicare Advantage plan, and they're going to get you on the phone and give you a hype on all these benefits. But you need to take the information and go do your own research. Make sure that the things that they're telling you apply to the county you live in, because Advantage plans, those commercials span states, but those Advantage plans differ by county. So you want to make sure that those benefits they listed off are available in your county.
That's great advice.
Yeah.
All right. So lots of people saying thank you to here. Thank you to you, Danielle. So I guess
you're welcome.
Kind of final pointer to what, in your opinion, is the biggest takeaway people should know about this, or biggest pitfall to watch out for with Medicare?
Yeah, so you seem like you have a pretty educated crowd here. We kind of covered the things about you don't want to assume that Medicare is free, and there's going to be some copays that you want to cover. One thing I do like to share with people is sometimes you'll have healthy people, and they may decide to skip the Part D coverage. So a couple things you just want to be aware of is if you have VA coverage, like through the Veterans Administration or Indian tribal benefits, you can skip the Part D and you can join later without a penalty. That's great. But my dad is a Vietnam era vet, and he does have access to the VA, and I still sign him up for a Part D plan. And the reason is, even though he wouldn't get a penalty, which a lot of your people would, there's a penalty that follows you and you'll pay. It's cumulative. It gets bigger with time. Then you really need a Part D drug plan, and you're going to pay so much more for it because you didn't have it when you first joined.
For
but
life,
in his
right?
case,
Once you start.
Yeah, once you're on it, it's with you forever. In his case, I was worried. I had heard stories from some of my prior clients with VA coverage that had said, they cover the generic, but I need this medicine, and I can't get it. They only cover these medicines. So I said, we're going to get you a drug plan. Well, he didn't want to. So I paid for the drug plan myself. I still pay for it today. And sure enough, within a couple months after he went to the VA, first of all, the VA won't cover drugs prescribed by a civilian doctor and vice versa. And the 2 brand name drugs that he needed were very expensive. The combined total would have been about $700 out of pocket. Well, the drug plan I got him offered both of them for a copay of $41. And so I always tell people, you never know what health conditions are going to come. We didn't know this with my dad, but I've been in this industry long enough to say, oh no, we're getting this drug coverage.
Right.
So even if you buy the cheapest drug plan in your state, just so to avoid the penalty and have the coverage, all drug plans have to cover at least 2 therapeutic meds in every class. They have to cover certain classes of medicines like anti-cancer, antidepressant, anti-seizure, antipsychotic. Those have to be included. There's minimum guidelines that they all have to meet. And this year, coming up in 2021, there are plans out there for Part D around $7 a month. That's a phenomenal price and way too cheap to skip Part D because you're healthy now.
Right.
I have seen this come where someone gets an oral chemo med and it's $5,600 a month, or some of these new fandangled diabetes meds are really, really expensive, and the breathing meds are expensive. You don't want to take a chance that you're going to have something get developed in February or March or April. Now you have this problem and you can't get into a drug plan until the next January. You have to wait for that next annual election period. That's the bigger risk of skipping it. And agents like us, when we write a drug plan for you, after let's say you've been on Part D for a couple of years and then you come to us and we help you, the agent makes like $3 a month on a drug plan. You would have to sell a cajillion of them to make money. So please know that when I tell you this is not about a commission for an agent, I have really seen this where people make bad decisions on this. So get the cheapest drug plan that you can if you're doing original Medicare and Medigap and you're pretty healthy and you think you want to skip the Part D, get the least expensive one. It'll negate that penalty and it'll be there if you need it. You'll be really glad for it someday if you do.
Right. Yeah, that's great. I guess, don't be penny wise, pound foolish. And also keep in mind the 65-year-old you is planning for the 75, 85, 95-year-old you.
Yes.
So Right, and with retirement planning in general, that's the philosophy as well. So that's good to know. It applies to Medicare as well.
Yeah, look out over the horizon there and know that sometimes we may not be in such good health someday as we are today. And
Right.
don't put yourself in a situation that you later regret.
Yep. Well, great. So, before wrapping, I just want to say, definitely everyone get this book. I'm not just saying this because Danielle's here. I bought this myself. I read it myself. It is fantastic. So, it's
Thank you.
10 mistakes, but it's not just here's the mistakes. It does it by way of actually teaching sort of from the ground up what Medicare is. So if you thought, today's session was helpful, definitely everyone would benefit from this book. So Danielle, where can people go to get this?
You can go to Amazon. We have a Kindle version and a paperback version, and it's also available at Barnes & Noble and I think a couple of other places, but easiest to find probably on Amazon.
And your first book, right?
It's my first book. Yeah.
Yes, very well done.
Yeah, we're so happy to have it. We did a lot of collaboration and a lot of polling of our Facebook group members to find out what were the biggest mistakes that people made and regretted.
Yeah.
So there's a lot of research in there that comes from actual people like you on Medicare. And we wrote it to try to address the mistakes that we see people making most often. So it has been a labor of love, but now it's actually in print form, and we're glad to have it out there for you.
In other words, you're glad it's done and over.
Absolutely.
If people want to find out more about, Boomer Benefits, what you do, how they can work with you, where should they go?
Boomerbenefits.com is a great way to find us. And if you are watching us on Facebook, you can also come to our Facebook page. We have a private Facebook group that you can join from there called Medicare Q A. And that is really the place where you can go and post questions and get them answered by our team at any time. You don't have to be a client or a policyholder. Even if you have TRICARE and you'll never need our help, you can ask all the questions you want to, and we're more than happy to have you.
Yeah, I can personally attest. So I'm a member of that group and I've been for a while. It's 10,000 people strong at this point.
Yeah.
And your team, super responsive with getting back to everyone with very good answers. So
Excellent.
I think everyone would definitely benefit from that group. Anywhere else? You mentioned you have a blog as well.
Yeah, so boomerbenefits.com. If you're doing some preliminary Medicare work and you're just doing some of the initial reading, there's great information on there from the website. You can sign up for a free Medicare 101 webinar that I teach. That's kind of like the big picture view in 60 minutes. And then we also have a 6-day email course that you can sign up for where you get one email a day with a really short video teaching you a concept that you need to know. And by the end of the week, you have a pretty good working knowledge of some of the things we talked about tonight. So the website, you can find all of that on there.
Awesome. And I just thought about this now. In 20 years, will you rename the company Benefits, Gen Extra Benefits or something? Or,
I've wondered that myself. We have people ask all the time, is this baby boomer or sooner boomer? And I'm like, if we have a football fan, I'm a little worried about what to say there. So maybe we'll be sooner boomers at that point. We'll see.
All right. Very cool. Well, looks like that's it. So thank you tremendously, Danielle. I know you can't see the comments, but lots of comments, lots of people thanking you and saying fantastic presentation. So thank you.
Glad to hear that. Well, thanks so much for having me. I really appreciate it. And you guys have a great night.
You too. Thank you. Take care.
Bye.